So, good morning, ladies and gentlemen. We invite you to a small but special program for the students of German language and who are going to do their Krankenpflege Ausbildung in Germany. So, before we start, I would like to say something. Many are under the impression that once you pass your B2 and once you have the B2 certificate in your hand, everything's done and everything's successful and nothing more is to be done. That's a very wrong idea. What you should be having in the hand is not only a B2 certificate, but a very good and effective German language. Please do not underestimate that. So it is with this intention in mind, we are going to do with some of the basic vocabulary as far as nursing is concerned. Let's begin. Aufgaben der Pflegekraft. Aufgaben means the task, the job. Pflegekraft, nursing team. You know the expressions Krankenpfleger, Krankenpflegerin. But usually in Germany they refer to the nursing team as Pflegekraft, the nursing team as such. Now, what all things belong to the job of this nursing team? Fundamental vocabulary is being dealt with here. As far as a nurse is concerned, there are a few things and there are a few terminologies with which you should be very, very thorough. Otherwise, you will have big problem in your profession. Look at the term Grundpflege. Grundpflege is a basic nursing, the basic things that belong to nursing. And to this basic nursing, one is Körperpflege. Körper is a body, and nursing or to look after the body of a patient. Now, what is that? To look after the body of a patient. That is waschen. You have to keep the body clean, wash the body of the patient. Or the duschen, take him a shower. Mundpflege, the mouth should be properly neat, the hygiene as far as the mouth is concerned. Haarpflege, caring for the hair, it should be combed and kept well. Darmblasen Entleerung. Entleerung is making something clean, to empty. Darmblasen. Darm is your intestine. Blasen is urinary tract. That means the patient should be taken to the toilet in the proper time so that his stomach is clean. And then besides that, medizinische Behandlungspflege, medical attention. The doctor will prescribe many medicines to you to give to the patient, and you have to look at the proper time and administer these medicines to the patient at the proper time in the proper dose. That is what is meant by medizinische Behandlungspflege. Then Altenpflege also is a part of this Pflege. Altenpflege usually takes place in an Altenheim where people are very old. You have to look after them, and all the above Pflegen what we have mentioned earlier comes to this also as far as Altenpflege is concerned. Then there is Wundversorgung. Wund is a wound in the body of some patient. You will have to look after, give proper care to the wound. And here a very, very important term is coming, that is Verbandwechsel. If a wound is there, then naturally there will be a bandage or a plaster. And this has to be changed every day, or maybe if the doctor is telling you change it twice in a day, you will have to do it. And the doctor will always will not tell you Verbandwechsel. There are many, many abbreviations, short forms for many things with which you will have to be very, very familiar with. So, Verbandwechsel is known as VW oder Medikamentengabe, to administer proper medicine, oder Blutdruckmessung. Blutdruck is blood pressure, Messung to measure, Blutdruckmesser to measure the blood pressure, Blutzuckermessung to measure the blood sugar. Then there are two terms, ambulante Versorgung und stationäre Versorgung. Ambulant is outpatients. They are not in the hospital, but they are coming as outpatients, see the doctor, get the prescription, and they will go away. You will have to take care of them also. That is known as ambulante Versorgung. Inside the hospital, there will be beds and the rooms, and patients will be lying there to look after them. That is stationäre Versorgung. So these are the very, very basic terms with which you should be very, very careful. And now we are coming to another part, which is known as Kommunikation in einem Krankenhaus. Communication inside a hospital. Now, what do we mean by that? We will have to talk, you will have to talk to the patients, to the relatives of the patients, and to the doctors, and unless you have a very good vocabulary as far as the medical science is concerned, you will be, you may not be very successful in your profession. So make two things very, very clear. As far as the professional berufliche vocabulary is concerned, you should be very careful about that, and how to deal with the patients, what sort of a language you should use to the patients, and also with the relatives of the patients under different circumstances. That also you have to master. There is no other group. So that's what we are trying to do here today. So Wortschatz in der Pflegemedizin, basic vocabulary in the nursing or in medicine, and different Situationen in Berufsalltag. The situations will be different. There will be critical patients, there will be patients who are going to die, there will be patients who are going to get soon well. So the situations also will be different in a Krankenhaus, and you will have to adjust with all these situations with that particular vocabulary.